I look after the food services team at Nottingham University Hospitals. I've been the trust lead for food safety for quite a number of years as well, so I'm quite passionate about embedding food safety as well as having a good food safety culture. So what I'm going to do is, I do tend to go on a bit, and I've only got 20 minutes, so I'll need a cue from the back to say where I am. Two things I generally talk about. One, I'm passionate about catering, and the other one's Volkswagen camper vans. So as my colleague says, never engage me on Volkswagen camper vans because you'll never get away. Okay. Yeah, so I'm just looking at a couple of case studies for myself to show you. So case study 1 was developing a training pack in level 1 to try and engage the nurses better. So we called that food safety and catering. And also the other one was looking at our food service model at ward level to try and ensure we got that nursing engagement, because we had lots of different ways of doing things, which I'll talk a little bit about. So we wanted to basically encompass it all together. And for the presentation as well, I was asked to do something quite practical and on the shop floor. So I'm pleased to be representing that side of the field as such. Okay. Just a quick one about Nottingham. Centre of the world, fantastic football, all the rest of it. But Nottingham University Hospitals, we've got two. We've got the City campus and the QMC campus, both about 1,000 bedded hospitals. So, it's quite busy place to be. So that's just a bit of geography of Nottingham. So while that's up, I'm just going to tell you what we do for our catering side. So we've got a central production unit or kitchen based at the City campus, and we produce cook freeze food, and we make 80% of our own food. That food also goes around the short trip around the ring road to QMC campus where ED is as well. So we use cook freeze in 80% of our food. We run a 1-week menu cycle and a specials menu as well. Food service at ward level, we use the Burlodge dollies and transfer systems, the Burlodge ovens to regen the food, and our food service assistants from 7:30 a.m. to 6:30, 7 o'clock p.m. They look after the majority of the catering at ward level, serving teas and all the meals and everything else. And then they also do the iPad ordering. So as you're quite aware of now is to electronic ordering, go to all the FSAs, and then we get all those orders in on time for our areas to pick them and send those meals out. So it's quite a slick operation. And also pleased to say we are an exemplar site as well for the for NHS. Okay. So case study 1. So we've had training for food safety for our caterers for a number of years, and it was quite diluted really in terms of the nursing teams. We had a bit of a fact sheet, and occasionally they did a quiz. We used to deliver foundation level 2 food safety training through the RSPH as well, but obviously COVID hit and various other things. So what we wanted to do is really create something new and something we could engage in, not only food safety, because it can be a bit dry, can't it? Unless you tell somebody that's died or an allergic reaction to something, people kind of don't engage in food safety as much. So we tried to lump that with an actual involvement in the actual catering service as well. So a bit of a training overview there. Okay. So we've got to ensure all food handlers across NUH are competent in food safety matters. And me as the trust lead and gatekeeper for the food safety policy, we make sure it's all written into that policy and pass through the trust and all the rest of it. Supported by, we've got an NUH training team, which is really good, our EFM training team, sorry. So they really support us with everything that we need to do. We're lucky to have, there's about 6 of them that are involved in that, so that's good. So we use the intranet and our training through the ESR, so I'm sure you have electronic staff registers. And then obviously everything that we do, we always share with the environmental health officer. It's always a bit difficult when we're trying to send files, getting them through the firewall, but we engage with environmental health and share everything with them. Okay, so before I talk a bit more about level 1, I'm just going to give you a brief overview. So this is hopefully not going over old ground for you, but our catering staff and food production, and food service staff, and also our nutrition excellence leads. They all engage in foundation level 2. Like I say, we used to do Royal Society for Public Health classroom. COVID hit, we all know the story after that. So we went to basically e-learning through Highfields, which our training team deal with that. So all the modules are there, and it's quite good. We register all the staff, all our catering staff do it, nutrition link nurses, and you know, away we go with that. They also have a yearly refresher quiz as well. So every year they'll have a refresher quiz uploaded, and they have to do that and pass. If they don't pass, then we make the assessment, do they need to do level 2 again, or can we do some coaching and some training and get them through that. Similar to level 3, so catering team leaders all engage in level 3. So again with Highfields food, so Highfield Foods e-learning training. We've used a couple of different modules before, but this one we find, you know, the best, most professional, and it's got really good content in it. So we like that one. So that's all on level 3. So we also engage in level 4. So all our catering managers and assistant managers, they all have to undertake foundation level 4. And again, all this guys embraces that food safety culture. Everyone's engaged. Everyone understands in that side of things. Currently at the minute, I'm just writing the level 4 actual quiz, because they think they're getting the level 2, but they're not. They get the level 4, and it can be quite taxing for them to a certain extent. Okay. So the reason why we've sort of pop this in, so our level 1 is really to engage nursing staff, engage volunteers, engage anyone that's really a food handler at ward level. So we've put this together. So to further educate catering staff, so all our catering staff do this module as well, but they kind of do it in steps. And really it's around the nursing teams engaging more. So the training is basically, we've put a series of training together, kind of podcasts. I'm going to show you some examples. They've not got the subtitles, but the subtitles have got the words and all the jiggery-pokery to them as well. And we cover sections like dietetics, nutrition and hydration. And this supports you know, catering at ward level. It also supports out-of-hours catering, because you know, when our caterers have gone, you've still got another X amount of hours for the patients to have safe food, nutritious food, and make sure that they're all cared for. So raise the profile of nutrition and hydration through our nutrition excellence leads. And the nutrition excellence leads get about 6 hours a month, and they have study days and things, so they really support us as well as the dietitians. Yeah, so this has supported the food service model, food charts, red trays. So this all kind of supports anyone old enough to remember better hospital food and assisted meal times and all those things. It kind of engages and tries to embrace all those things as well. So essentially what we put together is nutrition A, nutrition B, and nutrition C. So we've got 3 different modules in the first part of it. And as you can see there, it covers a multitude of things, you know, from allergens, dementia, low fibre, metabolic menus. So we've got like a bit of a podcast for each one of those, and that constitutes of nutrition A, B and C. I'm just going to give you an example of a couple of the slides. This was from, I believe, which one it was now? Oh yeah,
diabetes is a lifelong condition that causes a person's blood glucose level to become too high. It can happen when your body doesn't produce enough insulin, or the insulin it produces isn't effective, or when your body can't produce any insulin at all.
So I think you get the kind of gist. So we've got a number of slides like this.
In all types of diabetes, glucose can't get into your cells properly, so it begins to build up in your blood. Too much glucose in your blood causes a lot of different problems. But we all need some glucose. It's what gives us energy.
So essentially those modules are all, there's so many slides in each one that can take between 10 minutes, 20 minutes, 40 minutes depending. So they're all put into those modules. Now to support that as well, we've got, we always run a food safety fact sheet and a quiz. So they read the fact sheet, have to do the quiz, and away you go. We also have an allergen fact sheet and quiz as part of this training package. Then we also have a food service and catering toolkit. So essentially it's a pamphlet with all the information in for various things, and they have a quiz on that as well. I mean, you like it at our place, they have a quiz on most things, so which is fantastic. Yeah, so covering sort of things like red trays, protected or assisted meal times, manual nutrition, screening tools, meal times volunteers. So that covers a whole array of things as well. And believe you me, when the nursing teams realised that what was involved in this, it's kind of ran quite a lot of shockwaves over the two campuses. How are we going to do this? Well, we've got time to do this, but so we've got access to computers. You can spread it out over, a period of time and just bob in and out as you need to, and just, nibble away at it so you get the training and the understanding. So that comprises of level 1 in food safety and catering, and it goes through ESR as training modules or create classes, that kind of thing. So not all of them on yet. The team are just finalising some of them, but that's like the general gist for you. Okay. So in terms of getting that out and about, so we go to various meetings. We work closely with the dietitians, the nutrition excellence leads lead. We've got an EFM matron as well, so they're really supportive. They go out and spread the word on what we're doing. We present as well. A few other things, email to ward managers. We've got toolbox talks to catering staff that we do on a monthly basis. It goes in the EFM and governance reports. And also we present to the trust board. So I think it's every quarter, then we're invited to the trust board. We give them something to eat, which always helps, doesn't it? Give them something to eat. 3 puddings, gosh, you can have 3 puddings, job done. So we talk about what we're doing and, basically engage with the trust board at the highest level, so everyone's engaged. So I think that works really well. Okay, I'll still not mention camper vans, so we'll leave those questions till later. Okay. So the next part of it was really to, again, I've mentioned better hospital food and all those kind of things. So we've had quite a disparity across the trust with how we support food service. So at QMC we had a contractor in years ago, and their staff wouldn't move from behind the beer lodge oven, so the nurses had to get engaged. So the nurses basically co-delivered breakfast, they supported with lunch and supper, so we had a big queue of nurses helping, which was fantastic. Probably a little downside is that sometimes there may be too many, and we did road shows and things like that. The downside as well, part of the contract, they served everything on the same tray, so you had your starter, your main course, your soup, your pudding, everything. You got your mounted ice cream at the end and all the rest of it. So, and I've worked over both campuses, and I want to try to align both together, because at City Campus it was slightly different. So the food service staff have to do everything. Do the water jugs to start with. They have to do the breakfast, and there is some wards where they've got good engagement, but there's other wards where we're not getting so much engagement. So we've really been working with those wards to try and up the support. And what we've had to try and do is trying to make it so we've got a bit of a plan, a bit of something, a document that we can sort of share with people to try and move it forward, encompassing all the things that that we used to have, or we still have. And again, it's around that patient receiving, whether it's a nurse or a food service assistant, everyone's engaged in the same to give that quality food service and support to the patients to make sure they get the right nutrition. Okay. So nothing's rocket science really. All I basically did was put what we want them to do and popped it on a document, and then it's around getting buy-in to that document and then distributing it around really. But getting from both the campuses, there's real disparity in what they do, and I've had to go and meet ward managers. We've had to meet ward managers with the matrons. We've had to discuss how they deliver it and how they support. So that's what we've kind of done. So what I'm going to do now is really just put the document really on the slides and just have a quick flick through for you. So below sets out the duties for the food service assistants and the nurses to carry out to ensure that we get the right meal service really. So that was important, co-delivery at breakfast, particularly when we've got iPad ordering, because 9:15 we've got to get all the meals in through the iPad ready to be picked at the CPU or the RDU to get out. So it's really important that the nurses supported our FSAs in co-delivering that breakfast. So they take the trolley out and the nurses do one bit one day and then the FSAs do something another day. They kind of work together to get that meal service out. So we want lunch and supper to be supported by the nursing and catering team. So they, again, kind of co-deliver it, but they work together to make sure it's delivered out. And that can involve as well nutritional excellence leads looking after food service and also having a food service meal monitor from the nursing teams. And I've got lots of examples when I've been onto wards, and one of them was in maternity where the lady was taking a baby and she was going to get her food and she got a tray balance in one hand and the baby on the other one. That was I said to the ward manager, I says, do you think they should have some help? So we kind of built on that from there, and they had a mealtime monitor to support the meal services, so those kind of examples. I've got 7 drinks rounds a day. That's challenging, isn't it, with both parties as well. Okay. So running through it then, I'm not going to read out every slide on this, but if you just focus on the nursing side, you can see that they're involved in the service really, and when they get this document, they can see. So that's really the breakfast side of things. And this document will be reviewed and sent out again, I'm sure, as we progress. Meal ordering. So it's really important, meal ordering. So if I'm a food service assistant and I've got 30 patients to take their meal, and then I'm unsure what's the information is behind the bed, the nurses are not engaging to support it, it can actually be quite a long process. And the food service staff, it's fish today, yeah, fish, you're having fish. Friday, fishy Friday, everyone gets fish, don't they? But if everyone engages to ensure we can do it better with the nursing support, with the meal orders as well, so that part can be really important. Lunch and supper, so kind of things there for lunch and supper for the nursing teams as well. And obviously that's important, isn't it? Because the amount of food service staff that go to the patient and they've laid down, still asleep, haven't got the false teeth in, haven't got the glasses, they want to wee. By the time we've sorted all that out, the meal's gone cold, sat by the bedside table. So it's quite important for the nurses to engage into the pre-service work as well. So that's good. Okay, again, just moving on from that, again, the FSA's support and the nursing support in delivering the service. And it's really odd, really, because I'll go to certain wards at City Campus and they're doing fantastic, got a row of nurses helping. And I'll go to another ward and it's like, where is everybody? And then the food service staff running around, trying to do everything, getting some things wrong because they're just, rushing around. And it affects morale, and it also affects your costs as well, because some areas at City Campus where the food service staff come in early because they know they don't get the help at ward level as they needed to, so they'll come in at 6:30. Now, they're working half an hour maybe unpaid, which isn't right. So we need to have that engagement as well. Okay. Drinks rounds. I'm sure every trust battles with this, with all the drinks rounds. You've got 7 drinks rounds to do, so we kind of put that together to make sure that we're doing that right. Okay. So just coming towards the end in my short stint. Next step, similar to the other one with the food safety level 1 food service and catering. So more or less same thing, trust board involvement, EFM matron, toolbox talks for catering, visiting ward managers, getting out through the nutrition excellence leads and kind of the dietetics as well, so a whole approach to getting that support at meal times. So next step, so we continue links with food safety training, assisted meal times initiative, nutrition excellence agenda, volunteer mealtime programme, trust food and nutrition agenda, nutrition steering group, oversight group, and the government's hospital food standards. So we've got a good service at Nottingham, we've got good food, we have got good food service staff, we've got fantastic nurses as well, but in some potted areas it's not quite happening, so we've kind of drew some information together to try and get that done. And in this presentation I'll be using for the Matron's Day as well, and various other ones, so I'm hoping that will, you know, help. Away we go.